We can all agree that the Social Security increase that was recently announced, the 2.8% COLA for 2026, was a huge disappointment to seniors. Politicians have been saying they want to help seniors get ahead. The president has been saying that he wants to put more money in the pockets of Social Security and disability recipients, and yet majority of seniors do not feel that way. In fact, a lot of seniors feel that this COLA that was announced puts them back to where they were before because of rising inflation that seniors have been experiencing in many areas, including housing, transportation, electricity, food, healthcare, etc. So, what is the solution to put more money in the pockets of seniors? Well, there's a new proposal that a lot of senior advocacy organizations are getting behind. Is called the Elder Index. And in my opinion, I've been doing this for 15 years. This is the most exciting proposal that I've seen that really gets to the heart of the problem, which is measure senior living the right way so that you can put more money in the pocket of seniors. I am going to explain to you what this senior elder index is about, how it works, and why I think it is the biggest policy proposal that is a game changer going forward for seniors. And I think the president and Congress should get behind this if they want to make a real difference in the life of seniors. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and all other personal finance topics that affect seniors and their retirement, their pocketbook, and their finances. So, if you are new to my channel, welcome. I am glad you're here. Do me a quick favor, go into the comment section and let me know your city and your state. If you've been watching my channel for a while, welcome back. I am glad you're here. So, I am going to do this in 3 parts. Number 1, I am going to give you senior reaction to the Social Security cost of living adjustment. And then number 2, a lot of politicians believe that seniors are okay living on Social Security alone. And I've been saying this for a while that seniors are not okay. Living on Social Security alone is a struggle for a lot of seniors. And so now I have the data and I'm going to share with you how seniors are managing to barely make it on Social Security alone. And then number 3, I am going to talk about the Elder Index and why that is so critical in helping seniors get ahead. But before I do that, there is a particular quote that I want to share with you that I think highlights the plight of seniors right now and why this needs immediate attention. And this is from the National Council on Aging, and they did a research report, and they are one of the organizations that are advocating for the Elder Index. And here is what it has to say. It says millions of older Americans who worked hard and played by the rules are dying early simply because they don't have sufficient financial resources. This is a call to action to change our policies and systems to ensure that every person can have enjoy the gift of longevity, not just the wealthy. This is a tragedy that seniors who were told to play by the rules, work 30, 40, 50 years, pay into the system, pay your social security taxes, and then at the end, the government will give you enough money to make a decent living. And a lot of seniors are not feeling that. I am going to give you reactions to the Social Security cost of living adjustment and to prove to you that a lot of seniors are struggling. And I gathered a few of the highlights of what seniors are experiencing. And I want to share that with you so that it can give you background on what is happening. So let's jump into that. So the first one, obviously, is that the president has promised a lot, that he's going to do a lot for seniors. He did it in his campaign. He promised that as president, but yet, even with the big, beautiful bill, half of seniors are not seeing any relief. Why is that? Well, let's hear from seniors themselves. Here is somebody that says they are living on $980 a month and struggling. I live in Newton, Kansas, and I'm 72 and retired, and I only get 980 per month. My rent is 650 plus. I have to pay for electricity, and not to mention car insurance, food, car tags. After I pay electric, I hardly have anything left, which I can get some food stamps. but that doesn't take care of me for the entire month. Before the month is over, I am down to either bread and milk or sometimes not. I mean, think about that. As a senior citizen who have played by the rules, this is what some seniors are experiencing. I'm going to give you share some more with you so that you can understand exactly what is happening. Here's somebody living on $1,100 a month in Florida. I just retired and I just couldn't emotionally or physically handle the stress of working anymore, but it's only $1,100 a month. I opt out of Medicare Part B. It's expensive, $185 a month. I can get a regular health insurance plan here in Florida way cheaper. I don't have a car payment or a mortgage. Everything is paid for. How can I live off $1,100 in Florida? Is it possible? Thank you for your channel. So here's another senior who is making a hard choice between, healthcare and other priorities because they're getting $1,100 a month in Social Security. So while I do this, I want to encourage you, if this is your story, I want to hear from you in the comments because I want to gather as many of these stories as possible and share them because I think that a lot of politicians do not realize the struggle that seniors are facing living on a monthly basis and trying to just make it work with Social Security alone. And a lot of people like to say, oh, Social Security was not meant to be the only thing. Well, if you have lived a middle to lower middle class lifestyle, you realize that it is very hard to just get by, let alone save a lot of money for retirement. And so a lot of seniors find themselves in a situation where they retire and Social Security is the only thing they have left. And that is through no fault of theirs. It's the system and how it's set up. And it is not set up to benefit a lot of people in the middle or low income categories. By the way, if you want to continue to get updates from me by text message, I encourage you to join my text club where I send you 1 or 2 text messages a week sharing breaking news and updates, anything that's going to affect your retirement, your benefits, your finances. I want to be the first to bring it to you. Text the word insider to 443-293-0080. You'll be added to my text list. It's free of charge and you can get updates regularly on things that you should know. So let's go to the next comment so that we can continue this. So here's another person says, plus my rent is a 35-year-old apartment has gone up consistently for the past 5 years, $30 a year. So I'm now paying a little over $1,000 a month for an apartment in Tuscaloosa, Alabama. It's costing, I'm drowning. So rent has been one of the places that seniors have been talking about a lot, that they've been hit hard. Affordable, somebody's talking about affordable housing here. They want me to do a whole video suggesting affordable housing, 55 plus community. So I'm going to work on that and put a whole guide together and put a presentation together. So thank you for suggesting this. Here's somebody else. Wonderful to meet you, Kwame. I am Cheryl. I am from the Bay Area, but retired to Kentucky in 2000. The move was due to finances and family that reside in the area. It has been a good move. I bought a home near Lexington and Louisville. Generally, it's been lovely. Of course, I miss San Francisco Bay Area, but due to the outrageous housing costs, many folks my age are truly suffering trying to remain in California. My 77th birthday is approaching, and I continue to work occasionally. My health is great, and our life is somewhat stress-free. It was a huge decision to leave my dear California, but I would suggest to anyone retiring in the most expensive areas of the country to be brave, make the move. Never did I think I'll live in Kentucky. I have learned that it takes me 4 hours to be in California. So the point is that, a lot of seniors are even living places that they loved, living communities that they grew up in that they loved, just to make work, just for the retirement money, because obviously you cannot, live a decent retirement on $1,500 in a place like California unless you make some great sacrifices. So I'm going to walk you through, now that I've shared a few of these stories with you, I'm going to create a whole video just sharing these stories. So that is coming up. Stay tuned. But I want to share with you, how are seniors living on Social Security alone? Well, let's get into it. So here's what I found based on my research of, when politicians are saying that Social Security is enough, I want to show you how seniors are making it on Social Security alone. There are 6 different areas I want to cover. The first one is that housing is critical. Owning a home is a key advantage. Seniors who own their home outright face fewer costs, keeping property taxes, insurance, and utilities manageable, and making survival on limited income possible. Renters struggle the most. Elderly people paying rent often face poor nutrition, limited healthcare, and unsafe neighborhoods due to high living costs. Subsidized housing is an option. Many seniors rely on subsidized housing where rent is based on income and utilities may be covered, but demand exceeds supply. A lot of seniors tell me this, that even when you try to apply for subsidized housing, the options are limited, the wait list is long, and it's very hard to get. And then it says reverse mortgage. Some seniors tap home equity through reverse mortgages when other options run out, though fees can reduce inheritance. So yeah, reverse mortgage is an option that seniors have been tapping into, but it means that if it's the way it's set up, at the end you could lose your house, because that's the whole point of reverse mortgage, is that the bank takes it over, or the lender, once you pass on, if you took all the equity out. Family support is another critical area that is helping seniors be able to live on Social Security alone. Many seniors depend on children or relatives for groceries, utilities, and basics, making survival more feasible than for those with no family. So, if this is your story, if I'm sharing something that you can relate to, I want to hear from you in the comment section. Living with family is common. Multi generational housing is now a thing where multi generations are living in the same house in order to be able to make things affordable, with several family members sharing rent or a paid off home. Isolation is risky. Seniors without family or a strong social network are more likely to become homeless or enter into low quality assisted living. And then community bartering. Some seniors trade goods or services with neighbors to get by, especially in rural areas where family support is limited. This is how seniors are living on Social Security alone. Financial survival strategies. Government aid is crucial. Medicaid, food stamps, and you know the government has cut a lot from food stamps and Medicaid during the Big Beautiful Bill, and seniors are the most impacted. People on disability are the most impacted. Low-income families are the most impacted. And so a critical lifeline has been cut for a lot of seniors. Cutting expenses when necessary. Seniors report living extremely frugal, limiting outings, eating simple home-cooked food, and seeking community food banks. That is the reality for a lot of people. Supplemental work. Some seniors continue to work part-time at odd jobs well into their old age to bridge the gap despite physically challenging. And ageism, which is a big thing. A lot of seniors want to work to supplement their income, but ageism, discrimination by age, is real in hiring today. If you face this particular challenge, let me know in the comments. And then international relocation. A lot of seniors have been forced to move abroad just to stretch their Social Security check, moving to Mexico, the Philippines, Southeast Asia, the Caribbean, just to make it work. Health and well-being challenges. Healthcare expenses. Health costs are a major risk factor. Medicaid may cover some needs, but many go without proper care. Many seniors go without proper care, risking chronic health decline. Mental health issues. Loneliness and depression are common, especially for seniors living on Social Security alone, especially those in poor housing or isolated from family and community. Food insecurity. Many must rely on food pantries and government meal programs to access enough nutrition, leading to poor diets. And then disability impact. Seniors on disability often find government paperwork and aid complex, adding to daily stress and survival challenges. If this is you, I want to hear from you in the comments. So when we talk about the COLA, the 2025 COLA was the smallest in several years, making it harder for seniors to keep up. And then inflation continued to eat at seniors' income. Most seniors feel their benefits are not matching their true rise in prices for essentials like food, rent, healthcare, and putting additional strain on their budget. Nearly all surveyed seniors, based on my research, want reforms in Social Security benefits, the way they are adjusted and calculated, and that is what I want to talk to you about. But community resources are important. Many communities provide home meal delivery programs and congregate dining services that help seniors local transportation. I know in Maryland there's Neighbor Ride that helps seniors get around, caregiver and companionship support, volunteers, and paid companion programs such reduce isolation, while caregiver support services offer break and guidance for those assisted living elderly that are trying to live and age in place. Social workers are helping seniors navigate aid, but that could also be a challenge. So I've painted this picture for you because I want to share with you the most important thing that I wanted to talk about today, which is the fact that there is a new program, a new system that is being advocated for that is going to help seniors get ahead, and it is called the Elder Index. So the Elder Index is a tool that shows how much income older Americans. I want to make sure that you were seeing that. Sorry. Let me remove this and then put that up. Okay. So, what is the true cost of growing older in America? That is what the Elder Index is trying to answer. And it says that the Elder Index is a tool to show how much income older adults need to meet their basic needs and age in place with dignity. You can compare county, state, and national Elder Index values. So basically, this is a website that was created by the University of Massachusetts at Boston. And basically, it's supposed to show by location how much you need realistically as a senior citizen to live, to live and age in place with dignity. Why is that important? Well, a lot of government programs use the government's poverty numbers to calculate benefits. So the federal government releases the national poverty level and is supposed to be used to calculate how much benefits you can get as a senior or somebody on low income. But the federal poverty level does not truly reflect what seniors actually face in terms of, you know, cost challenges. And so what happens is that seniors are always left behind because the federal poverty numbers does not really accurately show what the situation is for seniors. So if you look at the federal poverty numbers, which I'm showing you on the screen right now, to be living in poverty, you are making $15,650 or less. But really, in my opinion, if you're making 25,000 or less, you are living in poverty really, because it's hard to even live on 25,000. It means that you're living on $2,000 a month. And that is the average social security check. And so in a lot of places, the social security check does not stretch that far. And if you're trying to apply for benefits like Medicaid or food stamps, they tell you make too much money because of this chart, this federal poverty level number, which lowballs seniors into claiming that seniors are making too much money, so they don't qualify for food stamps, they don't qualify for Medicaid and other benefits. But then in reality, in a lot of parts of the country, you cannot even live on $2,000 alone. And so the Elder Index is supposed to show that based on where you live, how much do you need? And the idea is that they are pushing the Congress and the president to adopt this measure so that seniors can get a true income that reflects their living situation and the prices that they face. So I'm going to go in and show you how this works, and you can go to the website yourself and play around with it. It is elderindex.org. So you go in there and you put in, let's say, let me put in Philadelphia. Okay, let's say Philadelphia County, Pennsylvania. And then you can say that you're a single senior citizen, you are renting, and you're in good health. How much do you have to make? And it shows that you need $30,000 to be able to make it in this particular county if that's where you live. And it shows that when it comes to housing, if you're renting, your rent is about almost $1,200. You're going to spend about $324 on food. If you're in good health, you're going to spend about $452 a month on healthcare. Transportation about $232, miscellaneous $318. So you need $30,000 to be able to live in this area. And that is the basic idea. And so why is this necessary and why is this important? It is because this allows the government to create a social security system and increase that acknowledges that the federal poverty level chart, which I showed you, is not realistic, because that is showing, even for if you are 30% above poverty, you are $21,000. That's how much you're supposed to be making to be 38, almost 40% above poverty, according to the government. But if you look at the elder index that I just showed you, if you live in Pennsylvania, in that area, in Philadelphia County, you need to make $30,000 in order to survive. So this index then begins to guide local politicians when they're giving government benefits. It can be used for food stamps, for Medicaid, for housing assistance, for utility assistance, and be able to realistically show, depending on where you live, how much assistance you need to be able to live a decent life. And when I showed you that quote, I'm going to go back to that, because that is the essence of what I'm trying to say. It says that millions of older Americans who worked hard and played by the rules are dying early simply because they don't have sufficient financial resources. This is a call to actions to change our policies and systems to ensure that every person can enjoy the gift of longevity, not just for the wealthy. And this is how you do it, is by adopting the elder index, because that helps rebalance everything. And when it comes to aid specifically for your local area, that can help you get ahead. So, again, if you want to stay on top of the news and get breaking news updates, then join my text list at 443-293-0080. Text the word insider. You'll be added to the list. This is free of charge, and it helps you stay ahead of the news. Not only that, get context around how the news affects you, your retirement, your benefits, and your finances. So let me know what you think. I have shared three different things with you. I shared with you, how seniors have reacted to the Social Security cost of living adjustment. And then I shared with you how seniors are living off on Social Security alone. And then finally, why this elder index is the solution. Let me know what you think about all three in the comments. And then finally, we are in Medicare open season, and open enrollment is here. And as I have been saying, if you've been watching my channel for a while, I am making a commitment to help 100,000 seniors during this open enrollment season get peace of mind about Medicare. Why is that important? Well, you earned it, first of all, and you might as well get the best out of it. But 90% of all seniors are in the wrong Medicare plan. Why? Because one, is complicated. It's overwhelming when you have 24,000 plans, and Medicare Advantage plans are also specific. Supplement plans are also specific to your area. And so navigating all that, especially given that there's so many changes happening in the news, it gets hard to keep up with what is changing with your existing plan, what is being taken away, who is staying in what state, what hospital networks are dropping what plans. It all becomes overwhelming. And so the solution is to have an advisor, an unbiased, free advisor that can share with you what you are eligible for and help you switch to a better plan. Now, the worst thing you can do this year is to just renew your Medicare plan automatically. And there are three reasons why you should not do that. The first one is that if you are in original Medicare, there's a big change coming. If you live in one of 6 states, you are now going to require pre-authorization in order to get access to certain services, procedures, and devices that your doctors think that you need. You now have to go through an AI tool to get pre-approval. That's the first change that is happening next year to original Medicare. Essentially, they're trying to turn original Medicare into Medicare Advantage. The second change is that Medicare Advantage plans are drastically being pared back. A lot of them are leaving specific states and communities. Some hospitals are dropping Medicare Advantage plans, and specific things that you used to get for free. Some of you are getting grocery cards. You're getting rides to certain appointments. All these services are being pared back or eliminated. So the plan that you're on this year may not be best suited for you and it's important to review everything. And the third thing is prescription drugs. There are two changes there. One, drug prices are going up. Number two, drug prices plans are changing. So Medicare Part D plans are changing and prices are going up. And so it's important for you to take all that into consideration to make sure that the plan that you get for next year, your Medicare plan, whether you're on original Medicare and get a supplement plan or whether you're on an Advantage plan, that it meets your budget. And when I mean budget, it's not just the premium, because when it comes to healthcare, you have to think about the deductibles, out-of-pocket costs, copay, all of that together form the cost that you pay. And the average senior is paying $6,300 a year out of pocket. And so it's important to pay attention this year. And Chapter is our choice because they're not there to push you into any plan. They're there to show you what's available to you, what meets your budget, and the network that you need to be in, and then help you make a switch to a better plan that best serves your needs. So call them today. Don't delay. There's a small window for you to make a change. So call 539-205-2147. It's open enrollment. If the lines are busy, try and call again. Or if you rather that they call you back, you can fill out the form at askchapter.org/insider. I'm going to put the form and the phone number in the description to this video in the comments. I'm going to pin it to the comments. But this is your window to get that peace of mind that I'm talking about regarding Medicare, which is that you've reviewed your current plan, you've made a choice that fits your budget and your needs, and that you know that should you need medical care, you have the plan that can best serve you. So give Chapter a call today. And if you like what you heard today, hit the like button, hit the subscribe button. Let me know in the comments what you think about everything that I shared today. And I'll see you tomorrow in another video.